Ehsan, thank you for coming in and doing this interview. You got a marvelous background. You got a marvelous startup transforming healthcare. So thank you for coming in and sharing your insights with our audience.
Thanks for having me.
So Ehsan, what are the three sort of defining moments in your life that made you who you are today? It could have been when you were 3 years old, 5, 10, inside, outside the family. Could have been somebody mentoring you. It could have been an experience you had. It could be something that happened in school and an early job. What are those three climactic sort of really big moments that shaped you to who you are today and what you do today?
Oh, that's a super interesting question. Nobody has ever asked me that, not in that format. But it's actually quite easy. So I think the first one is probably when I was, I want to say 4, maybe 5 years old. So my background is bioengineering, and the entirety of my life has been about imaging of the eye. That has been my thing throughout through my academic and entrepreneurial career. The reason for that was because my father was blind when he was only 4 years old. And the only reason my father went blind at that age was because my grandfather was too poor. He couldn't afford an eye exam for his son. My father went blind. I grew up with a blind father. So to your point, the very first moment that sort of set the direction for my life was the moment that I realized that I cannot rely on my father to cross the road, and I'm the person who's leading him across the road. One of these early childhood memories that is vague, but you still remember it 40 years on, that I remember that I'm holding my dad's hand and we're trying to cross the road. This is in Tehran, in Iran, busy roads, not much rule of law when it comes to driving. And then I realized that I am it. I'm the person who's supposed to get my father from this side of the road to the other side of the road. And that hit me at that moment. And later on, I realized that everything I've done in my life about vision, eye, imaging, hardware, and software, all of that goes back to the point that I realized within the blind community, at least, there are a lot of sacrifices that you have to make. And as a child, I very quickly realized that I'm the person who has to get my father across the road. I'm the person who has to count money, because literally back then you're talking about notes and coins. And don't get me wrong, my father is a very successful person in his own right. He's a lawyer. But even with that qualification, even with that job, he needed me for very simple tasks. So that was the first thing. So that set me up for life to being around eye care in some shape or form. I guess the other defining moment was I reached the age of 18, 19, and at that time I was studying still back in Iran. And I realized that no matter how far I get in that particular system, I'm not gonna have an impact. It's limited. It doesn't have access to a whole lot of resources, so I have to get out. And I literally packed my bags, and honestly, as simple as it can happen, packed my bags, got on a plane, and landed in Sydney, Australia. I still remember, I had this conversation with my dad. I was like, Dad, I'm leaving. And he thought that I'm moving to another city. I was like, where are you going? I was like, I'm going to Sydney, Australia. And he was like, well, that's the furthest away you can get from. And it's like, yes, but the reason for that was there was this group in Australia, which still exists, and it's called the Bionic Arm. It's part of the University of New South Wales. I really wanted to work with those guys. And I literally packed my bags, landed in Australia, went and I met with my supervisor, and I said, I want to work with you. Doesn't matter. I just want to work with you. So that was the second defining moment, just getting out of one ecosystem and going to another ecosystem simply because um, you have to. It's the price to pay to get to what you want. And by the way, after Australia, I moved to New Zealand, lived there for a decade or so. After New Zealand, I moved to the United States. I'm here. So I've been an immigrant my entire life. All of that in the pursuit of achieving what I thought I should achieve in my lifetime. So So that was the second time when I realized that just by traveling, immigrating, going to a new ecosystem, you can do a lot more. You can just have access to a whole lot of expertise, resources. And I guess the last pivotal moment in my life was after about 10 years in academia. So by that point, I am an associate lecturer in optometry and vision science. I have published 40 plus papers, patents, all of that in eye care, imaging, vision science. And I realized that I haven't made the impact that I wanted. I've done everything right in my head according to my plan to do something about eye care, became an academic, became the top of my field, at least when it comes to publications, patents and all that. I did not have the impact that I wanted. I just realized it. So at that point, I was working on the research that is the basis of Toku, my company. And I had to make a choice. Should I stay in academia, publish the results, sort of hope that somebody will pick it up? Or should I just take over and start the journey myself? And sort of went back to the very first memory that I had in my life, that I am it. If I don't do it, nobody else might, or nobody else might do it the way I want it to do. So it's all, there's that famous saying, if not me, then who? If not now, then when? And that was it. That was like, I'm doing this. So I quit my very comfortable job as an academic, which was, I loved it. It was comfortable. And I became an entrepreneur overnight. I lost my job, my, comfortable 9 to 5, salary paid job, my sort of science and all that. And I just started this journey. It's been 5 years. I've learned so much. I've learned so much in the past 5 years. I've grown exponentially when I quit academia and I started my journey. And now I feel I'm making that impact. I'm getting much closer to the impact that back when I was 4 or 5 years old, I thought I would.
That's a really fascinating story. So early on, when you were, let's say, 10 and 11, were you interested in science then as well, your whole life when you were really young?
Absolutely. I've always been a book nerd. I've always been somebody who just learns. I remember, back in the day when you had these, not even PCs, but these Commodore and these things that you can sort of put together and then, try to run a very simplistic computer program on them. I started with those. I loved engineering. And by the way, when I reached my university age, my grades were super high. I was among the top 2% of the people in my field and all that. So I could choose the degree that I could apply for. It's just I could apply for anything. And I quickly thought that I don't want to become a clinician, although I have the grades to become one. Because I thought that another clinician won't help my father. It's just one more clinician is not the answer. Universities can pump out all the clinicians that you want, and still we are lacking that capacity to answer all the health needs. So this is my naive 16, 17-year-old, and I thought technology is better. Technology is scalable. And again, naive 16 years old, Ehsan thought that maybe we could come up with an artificial eye. Maybe we could build something that make the person see, and that's technology. So I essentially started bioengineering because somebody told me that bioengineering is the science of, or the engineering science of helping people with disabilities. And that just got stuck with me. And I just picked it as a career and studied my whole life in bioengineering.
And I can see how that fits, though. You have a father who has an eye challenge, and then you have to help. He's a lawyer, but you have to help, and even things like crossing the road and counting change and so on. And it made you really aware of the kinds of difficulties that create when you have a challenge, because you were immersed in solving those daily physical challenges, and I can see you have a talent in the academic side and science, and you're thinking, but I don't want to just treat people who have challenges. I want to be able to solve the problems.
Mm-hmm.
So that's
Mm-hmm.
where engineering comes, and then particularly bioengineering, because that then you can create a bionic eye or something like that, right?
Correct.
And that guides your early academic journey. So I can see the father, the early academic journey, being trying to create translational work that can translate
Mm-hmm.
into a product of some sort, and then getting into Australia because they had this top center in this bioengineering side. And
Mm-hmm.
you're following this path and then going to the States because the States is like a mecca for bioengineering as well.
Absolutely.
And,
Absolutely.
and so you have this kind of series of academic appointments from Australia to New Zealand to the US, and you're just further refining your bioengineering skills, publishing papers and getting patents. But then you realize research is one thing, but you've got to productize if you want to
Yes.
create meaningful change, right? So
Yeah.
then you decide to become an entrepreneur 5 years ago. So that would place it around 2018, 2019.
Correct.
Now, because I've been around for a long time, I'm in my eighth decade this year of life, right?
I would have never guessed.
So that means that, uh, and I work in academic communities. I work in the IEEE community, the ACM. We're number one in computing science community. I work with IFIP, and I have like leadership roles or a keynote and things like that in different communities. I know that when I deal with a lot of researchers, they're not realistic. They're going to do a startup. I remember because I'm an investor, I had this really famous researchers with also surprises, and we offered to help them, do a startup or at least look at, anyways, investigate whether we can fund a startup. But if you looked at that initial funding, the gentleman was looking for something like 300. He was valuing his startup at 300 million.
Mm-hmm. Mm-hmm. Mm-hmm.
And
Yeah.
so there's this kind of overconfidence in
Yeah.
research that hasn't been productized yet, and there's no product market fit yet. There's some kind of problem and solution, but there's no product market fit, and valuing it at 300 million, right? And so I find that there's this bridge. So I could see where you said a lot of learning has occurred when you decided to
Mm-hmm.
become an entrepreneur. So can you describe that journey? I mean, how did you first start? Because you've got the research. How do you sell people in the research to get funding? How did you get your initial funding?
So that's a good point. So because I had the advantage of being an academic and being in research, I was good at grant writing.
Uh,
I was really good at grant writing. Like I've got like few millions of dollars in grants. Simply because I wrote grants day in, day out. I was very active, publications. I think I was one of the best in New Zealand when it comes to getting grants in bioengineering and medicine. So, but I very quickly realized, to your point, research is research, and researchers tends to just go down this rabbit hole of trying to keep answering one question because one question leads to more questions. And you, first of all, you never realize where is that, to your point, product. There's a meaningful difference between research and a product. And also, again, to your point, researchers tend to overestimate the value of their work. What do I mean by that? When you're a PhD, when you're a postdoc, when you're a professor, it means that you know a lot about the tiniest thing in the world. That's what having a PhD means. That's what being a professor means, is that you're super good. You're the world expert in this narrow thing, the narrowest thing possible. There's nothing wrong with that. But then you want to apply that to the quote unquote real world, which is messy. It's got multifactorial aspects to it. You have to consider the regulatory and compliance, the business model, just the general, trade and manufacturing and all of that. usually the researchers assume that because I know so much here, I know so much over there, which is absolutely incorrect. So now there are some researchers like myself that, I'm willing to learn, very quickly realize that I'm wrong and I can keep learning. And I, usually I tell people that I have no ego. I enter every conversation expecting that I'm wrong. Absolutely. Whenever I'm wrong, which happens quite a lot, I'm happy because I'm learning. So there are few researchers like that can transition from knowing a lot about a very niche thing to starting to understand the rest of the field, everything that takes to bring a product to the market, which is the hardest thing ever. But there are many, many, many researchers that they get trapped in that academia mindset that because I know so much about this one molecule, it means that I know how to solve the entire medical system problem, which is, not true. So I think I've made few rules for myself. So rule number one, and these are early on, then year one of transitioning out of academia. Rule number one, expect to be wrong. I know that I'm never the smartest person in the room, nor the most talented person in the room, but I'm the one who's willing to learn and work. So I know that. And I meet with VCs that tell me that, A, B, C, and wrong, wrong, wrong. And I'm like, yeah, that makes sense. Let me go back and try to fix those. Or I deal with the FDA all the time. Same thing. I deal with big corporates. Same thing. So rule number one. Rule number two, whatever doesn't kill me makes me stronger. And I truly believe in that statement, in that becoming successful in anything, as an entrepreneur, as a sports person, doesn't matter, as a scientist, it involves pain. And the more pain you go through means that you are making more progress. So if, again, people coming out of academia, you're coming out of a very comfortable life. You're literally getting paid to answer your curiosity. That's the best, thing that you can do, right? However, the real world, and quote unquote, the real world is all about the pain. Talking to lawyers, accountants, investors, compliance and regulatory people. The more you pain your experience, the more you're learning, the more you're maturing, the more you're making progress. So I made it my sort of mission in my life that no day should go past without me experiencing some sort of pain because I'm learning. So I think those principles have sort of guided me through life. I mean, when, friends and people say, oh, Toku has achieved so much, it's because me and my group as a team, we are willing to go through that pain of challenging ourselves every single day.
So in 2019, you decide to create a company and go into podcasting that. Did you initially fund yourself with grants, or were you able to get angel investors to invest? And so what was that investment journey like?
That's a very good point. So University of Auckland, this is Auckland, New Zealand, where I was an academic at, they have a very good tech transfer office. So the tech transfer office, they give you non-diluting grants to get started. Not a lot, but for market validation, proof of concept development, and all of that. So I got sort of these special grants, and I think in the United States that you have SBIRs and similar grants. So I used similar schemes back in New Zealand to get going, but the expectation is that you start attracting external capital. So there's sort of a deadline. It's like, we're gonna give you this much money over this period of time, but at the end you have to bring in external capital from local and international VCs. So that's how we got started.
And what's that like pitching to VCs? What advice would you give people?
Expect a lot of no's, some for good reasons, some for not so good reasons. And you have to start thinking about the VC from their perspective. I think the first mistake of an entrepreneur is every entrepreneur thinks, I've got the best solution in the world. Do you truly believe that? You truly believe that I've got the best thing in whatever field I'm in? And when you pitching in front of a VC, and most of the time they don't get it, your immediate reaction is, why don't they get it? This is the best thing ever. And I'm the smartest person in the room, and I'm telling this guy that this is the best thing in the world, and they don't get it. I think you have to sort of flip that argument in your head and start thinking about the VC's point of view. Most VCs have gone through that journey several times themselves as an entrepreneur, and then observing and working with entrepreneur, and they see a whole lot of pitfalls. When you pitch an idea, immediately in their head, they go, oh, there are 10 different ways that this thing can fail. On the science side, on the clinical trial side, on the business model side, insurance. And immediately they get into that mode of how many different ways this thing can fail, which is true for every company. And then they try to essentially assess the risk. Is this worth my time? Is this worth my investment? Because all the investors think about is, there are so many opportunities and I have so much money. Just I have to allocate that resource to ones that I think are more probable. That's sort of a simple sort of statistics. So as an entrepreneur, you have to come up with answers to those questions about all the risk and be realistic. Yes, there is a risk here. Yes, there's a risk here. There are things that we can do to mitigate that risk. Rather than keep banging on this solution is the best solution ever, try to make your investor understand that you know all the risks involved and you're happy to face them and you have thought about them and have a solution or two in mind. I think I've never been an investor. I've seen many. I think a good investor will look at an entrepreneur and think, can I trust this person? At the end of the day, can I trust this person? Their level of judgment, their willingness to learn, the willingness to adopt, switch, pivot. Because if I can trust this person, then yes, there's going to be a lot of risk, but this person, this entrepreneur will survive. I think that's the real thing rather than, oh, I've found a cure for cancer.
So talk about this company called Toku, right? It's a healthcare technology company specialized in using AI-driven retinal imaging to detect health risks such as cardiovascular conditions, diabetes, kidney failure, and strokes. This was an extension of your early research, and
correct,
because you're not building a bionic eye here, so.
That's absolutely right. And again, that's one of those pivots. That's absolutely right. And only a good VC understands that. So when we started, actually we were thinking about creating a virtual bionic eye. That was the original idea, i.e., when you go to an eye exam through a process, the optometrist or ophthalmologist, they image your eye so many ways. There are so many imaging that happens in ophthalmic community. I think behind radiology, ophthalmology is the second image-heavy specialty. So my idea was, let's bring all of these modalities together, put them in a virtual environment, and that's your eye. That's your virtual eye. I do have a patent called virtual eye. So we create a virtual eye for you, and then the doctor has access to every modality that they have captured across several rooms on one computer, and they can see everything in reality. So the idea sounds great. And why not? Instead of going through 10 different machines, image 10 different times, and then the doctor has to go through every modality, just one place, you see it all literally put together as an eye, because that's possible. And then they come up with the diagnosis center. That was the very original idea. And soon after we got started, we realized that it's technically challenging, although it's possible, but it needs a lot of capital investment. Number two, the doctors are telling us that, why would I? I.e., I'm already going through this process with the patient. I've been doing it forever. And in many situations, I'm getting paid for this particular analysis and this particular analysis. So there's reimbursement attached to that. Why would I want to get rid of that? So again, as an entrepreneur, I would have battled the system and tried to say, no, I'm going to change the ophthalmic industry. And I don't think I would have survived that war. But then the question is, okay, what else can we do? we have a certain core competency here, which is about image analysis in eye care. What can we do? So my co-founder, who's a retinal specialist, he thought that, well, we don't necessarily have to put all of these images together. Let's see if we can find disease. So instead of the doctor going to look at these images and find disease, let us tell the doctor what the disease is. This is 2019, early days of AI as image diagnosis. So I think we were pioneers in that. So we started we quickly pivoted to that. So then came the second pivot. You see, as an optometrist or an ophthalmologist, you're trained for looking at images and identifying disease, eye disease. And that's a big distinction. So I saw many of other research groups and startups went down the path of, let's make that process a bit more efficient. Let's become a diagnostic for eye disease using eye images. And then again, as I'm talking to optometrists and ophthalmologists, they are telling me that AI is going to replace me. AI is going to do the job that I'm supposed to do. And there is an argument to be made that AI can do it faster, cheaper, more efficient. But at the end of the day, you're sort of reaching that resistance. You're facing that resistance from the community that I'm supposed to do this job. I've trained for so many years to do this job. So that was one element of it. The other element of it was we started to see other diseases in the eye. We started to see blood pressure, high blood pressure, or uncontrolled diabetes in the eye. Eventually, these things could lead to an eye disease, but at the very, very early stages, these are not eye disease, these are just systemic disease. So the eye can suffer from high blood pressure many years down the track. Doesn't change the fact that you have high blood pressure today, right? And as an eye doctor, when there are these tiny early signs of disease in your eye, you're not supposed to see them. You're not trained to identify that because it's not an eye disease. Your focus is end-stage disease when it becomes an eye disease. So then suddenly the conversation came around, okay, what if we expanded the scope of eye care? And eye care can become the front door to healthcare. There are so many people that are having an eye exam every day. In the United States, that's about 120 million people who have an eye exam every year. That's more than 3 times the number of people that go to their general practitioner and ask for a checkup. That's a huge part that the data around blood pressure, diabetes, chronic conditions like kidney disease, the data is there, but it's not mined because it's an eye care setting. It's focused on eye care. So the data is ignored. So very quickly we realized, why don't we just do that? Why don't we sort of essentially use the data that is there, it's captured as part of an eye exam, but then mine that data for other conditions of the body? The eye care provider is happy because that expands their scope of their business, that uses the data that they already have, and it doesn't come into their diagnostic realm, it actually adds to it, number one. Number two, the patients are happy because the patient who's having an eye exam, they don't have a chest pain. They're just having an eye exam. The fact that we can tell that you have high cardiovascular risk is just a bonus because otherwise you wouldn't necessarily go to a primary care provider if you don't have a chest pain. So the patients are happy, the doctors are happy. And then the question was, what's the business model? And I tell you something, again, going back to your comment about researchers believe that the science is the hardest part. That is so untrue. The hardest part is finding the right business model. That is by far the most difficult thing to do. And then the rest of the journey has been to develop a product around the idea of identifying early stages of the disease in eye care and getting paid for it.
So how do you get paid for it? You go into an eye clinic and you get you have AI detecting in the retinal images some of these sort of risks. How does the eye doctor make money from it?
That's a very good point. So let me flip that question back to you. When was the last time you had an eye exam? You were wearing glasses.
I don't know, a year ago.
All right. So all of us should have an eye exam almost every year. So thinking about the time that you went to have an eye exam, How much did it cost you, roughly speaking?
I can't recall, a few $100, I think, a few
Exactly.
$100.
Right answer. Few $100. And do you remember the split of that few $100? How much of it was for glasses? How much of it was the doctor fees and all that?
Um, well, the interesting thing is that I went through a ophthalmologist, and then he put me to a specialist.
Mm-hmm.
So, which was just pure eye related stuff, nothing to do with the optometrist. So that really, when I do things, it's really three separate people. So
Yep.
the glasses people are one group.
Mm-hmm.
There's the ophthalmologist is one group, and then there's kind of like the specialist, which is another group. So I actually saw three different people,
Right.
three different
Correct.
charges, independent of each other in essence, other than the
Exactly.
prescription being passed to the optometrist.
And exactly. Because the ophthalmologist gets paid out of your medical insurance, whatever that is. Same as the specialist. The optometrist gets paid out of vision insurance. And depending on what vision insurance you have to come up with a few hundreds of dollars. Some of the vision insurance is copay, some of it is sort of what they call agreed price, and some of it HSA, FSA, and cash. The whole point is that optometry, when you get to glasses and everything around glasses, like prescription for glasses and those eye checks, that lives outside of medical billing. Optometry business model relies on you paying for that services, which, by the way, it's uniquely true globally. Doesn't matter if you go to your optometrist in New York or London or Buenos Aires, it's the same business model. You pay for the optometrist's time to come up with the prescription, and then you pay for glasses. So now, the way we get paid, we insert ourselves as part of an eye exam, as part of a doctor fee. So we are not charging the patient, we are charging the doctor. The doctor then charges you as part of an eye exam, which is then contracted out to vision care providers.
I see. So the doctor could say, there's an option here. Because we're doing an eye exam, we could actually add uh, um, early detection of cardiovascular, diabetes, kidney, stroke. You could even probably add dementia, Alzheimer's, and a whole host
Absolutely.
of other things in there.
Absolutely.
And in fact, if you did a little bit of a small pivot with a partner, they could take some fluid examples for biomarkers for other things as well. Right? And you would say, yeah, that would be good. Yeah, yeah, it's going to be an extra $30. It's worth it for me, right? You know, check, check, check. Yeah, it's an option, but I would say people would want it, right?
Absolutely. As of today, more than 50% of people in the clinics that we are in choose that option. And again, many times that option is already covered by HSA, FSA, and your vision insurance. And sometimes just out of pocket. And again, it's all part of a what we call comprehensive eye exam, because you can have the basic one, and often you can have the comprehensive one as an add-on. We are part of that comprehensive eye exam. So we are never a single upsell. You're just part of an extended eye exam, which optometrists will sell to you because they can then sell it back to the vision insurance providers. So as of today, we are growing to we have one contract that has 1,400 clinics in it. So we are growing to 1,400 clinics. That's what consumes my day. Just grow to these new regions, every month we turn on a new or state or two. It's just what we are going through, that rapid growth right now. And it's all about that. It's all about working with the optometrists to expand the scope of the practice and charge for it, and then work with the vision insurance providers that then can co-pay that managed care patient.
Yeah, and you're currently doing cardiovascular, diabetes, kidney, and stroke, but really there's so much evidence in your eye of all sorts of maladies, right?
Absolutely.
It's like a
Absolutely.
lens into your entire brain and everything else, right?
Correct. Exactly. That's exactly how we put it. Your eyes is a window to your health. Everything that goes wrong inside your body shows up in the eye. And the late stage could become an eye disease, but the early stage is just a chronic condition underneath. And to your point, neurodegenerative diseases, pulmonary diseases, some forms of cancer, they all show up in the eye. And the huge opportunity here is that optometrists are everywhere.
Right.
Every shopping mall you go to, there's at least one, sometimes two optometrists across the world, by the way, not just in the United States.
So that's fascinating. So I can see then your revenue would be scaling and things like that as well, because it's such an easy check mark. I mean, it's AI.
Absolutely.
AI is not going to decrease penetration.
Absolutely. So our, maybe it's too soon, but we're talking about sort of Toku. So Toku's vision, no pun intended, but Toku's vision is to be everywhere, presented to everybody, and know most about it. So eye exam happening globally. And we are working with partners in the US and now globally as part of an eye exam. So I want every eye exam images that are captured as part of an eye exam to go through our platform. And then we tell the patient, these are the things, not just cardiovascular or kidney, but more indication. These are the things that you should pay attention to. And obviously for some of them, you have to go and see your primary care provider. But now you know.
Yeah, I mean, I can see how you could partner with many other people to do even more. And as the technology improves, you could even maybe make it some of it self done, right? Through, the quality of the cameras and things that are being in consumer devices is just getting better and better, including the
Exactly.
spectrums they can analyze, right?
So these are the next generation of fundus cameras. So you just could have an attachment on the back. They exist. They still exist. They already exist. Some of them are better than others. So very soon you could be able to capture retinal images using these machines. And again, as a technology platform, we don't necessarily care where the images come from. We are just a platform. But I'll give you a glimpse of the future that I believe is the reality beyond smartphones. The next big sort of variables are smart glasses. We know it's happening because Meta is investing in them. Now Google has invested in them. Big optometric brands like EssilorLuxottica, Ray-Ban, Oakley, they are investing in it. So it's happening. As of today, the smart glasses don't correct for vision. Very soon they will. Very soon your prescription glasses will be your smart glasses. So as an adult of a certain age, when you wake up, you put on glasses. I put on glasses because I need to see. Imagine a future that every morning you're wearing your smart glasses simply because you need to see, not because you need a smart device, but you need them on your face for you to see. And now it's, technically speaking, is rather simple to put inward-looking cameras on these smart glasses, which is actually much better than these, because when you use your phone, there's a bit of a hand-eye coordination that should happen to take a good photo. If the camera is sitting on your face, it's super easy to capture the image from the back of your eye. The future that I'm imagining is you wear your glasses every morning because you have to see, there's an image captured from your eye. Here's a health analysis for you. You look good. Happy days. And we are the platform that provide that health assessment to you every morning.
Yeah, and then the XR, AR, and VR environments are just getting better, and there's even lasers going into your eye, right, where they're tracking.
Correct.
I mean, yeah. I mean, I can see all of this. So, if you were to predict 5 years out, describe to me what it will be like for anybody out there, where you see the integration of all of the things you're talking about.
So, hopefully, in 5 years, we have solved the problem that made my father blind. What do I mean by that? Hopefully, in 5 years, these diagnostic tools will be sitting on your face as a cheap alternative, so you don't have to go to the doctor. These smart glasses will do all sort of diagnostic for you routinely, and every problem will be realized. So my father wouldn't have lost his eyesight because he didn't know. So I'm hoping that in 5 years' time, every, not just adult, every child, adult, everybody out there know all the issues that they have inside their body simply because they have smart sensors, glasses, cameras sitting on their face, affordable as part of their daily life, so you wouldn't miss a disease.
Yeah, and you already have the foundation for that. It's not a big leap because you already
Exactly.
have the technology. And
Exactly.
as the devices get more mature, then it's just a natural sort of scaling for you to be the next Jensen Huang, NVIDIA of the of the healthcare world, and I could see this having tremendous potential. Um, do you see something beyond Toku in your, I mean, clearly you're an entrepreneur, so you're going to focus on Toku, right? I mean,
Right.
you have investors, you have a commitment. Do you see something beyond Toku eventually? Other areas of interest or problems that can be translated into effective solutions, and what are they?
So it's almost like a bug, right? Entrepreneurship is almost like a bug. When you have it, you got it, and this is, and I'm enjoying the learning. I truly enjoy the learning. I think whenever we are done with Toku, whatever that end is, I want to stay focused on eye care because that has been my lifetime passion. I don't think I will ever move away from eye care. But we just talked about having these cheap diagnostic tools on your face. If I'm done with Toku and no one has done a meaningful thing about it, I want to start a company just around that because I have the technical background. I have taught optometry. I know whatever there is to go into selling a pair of glasses to a customer and taking care of that customer. I know the business model in that world now. I know a lot about that, right? And to me, again, going to the fact that many people go blind or die of a heart attack because they don't know of the risk that they have. So if I can have one more goal at entrepreneurship, I will start working on the next big pair of glasses that everybody will wear. And there are lessons to be learned here. Like companies like Meta, Google, they have what I call the curse of unlimited resources, which means that you just have too much money and you're just gonna go down these rabbit holes of doing so many cool things that have no real implications. Whereas a startup, you tend to be scrappy. You have one job to do and just focus on that one job. I think that will be my next company if I ever get done with Toku.
I see. Toku then become Glasgow.
We'll find a better name, but you're right. You're right. I think I'm so close. I am so close to finally be able to tell myself that I've solved the problem that went and sort of made my father blind. I'm so close.
Why do you call it Toku? Why the name Toku? What does it stand for?
That's a very good question. So in New Zealand, there is a native language called Te Reo. It's spoken by the native people of New Zealand who are called Maori. And when I was starting my company, I realized that I'm an immigrant, and my co-founder was also an immigrant. We wanted something to represent New Zealand, and again, we thought that we choose a native name. So Toku means we started with Toku Eyes. Toku Eyes means my eyes. But Toku, then later on we dropped eyes because we were not an eye company anymore. We were trying to solve bigger issues. Toku on its own means self and presence. So we sort of kept that goal. It was sort of a happy coincidence because one of my major investors is a Japanese conglomerate. They're called Topcon. And then they heard the name Toku. Everybody was so impressed. Oh, Toku, we love that. And it just turns out that Toku in Japanese means virtue. And they actually
Ah,
wrote the character for me, which is very complex Japanese character. And I loved it. So yeah.
that's interesting. That's an interesting background. Okay, so we went through this journey. What advice would you give to entrepreneurs who are thinking like you are So you're already immersed. You're already starting to succeed. You're in the Pegasus program, which is Microsoft's unicorn builder, which is the under 1% to gets into their program, which means that they believe in you. They're helping you scale. Um, so what advice would you give to entrepreneurs out there to be successful? Maybe 4 or 5 things that are required for them to be successful.
Um, but again, nobody has asked me that question. That's a very good question. I think first of all, think big, right? Every entrepreneur think that they're thinking big. Most of the times, they're not thinking big enough. Think big enough in that people get bogged down with their industry, TAM, SAM, SUM, all of that. Think bigger than that. Think the entire world. Think globally. Think, how do I address a problem for the entirety of the world? And yes, you're starting with a particular market. Yes, you're starting with a small thing. But unlike academia, you can expand. You can expand that scope. You can expand your horizon. So think big, number one. Number two, be flexible. Be very flexible. You know, things change every day. You may do everything right, but you might be in the wrong environment. Just, the politics of things, just a big company trying to replicate what you've done, all of that. Be flexible. Just change your path as quickly and as often as necessary, because that's how you succeed, not by sticking to your guns and say, no, I'm doing this because I thought I'm going to be doing this, which is also, by the way, is common in people with academia, that they tend to stick to one thing, right, and be flexible about the idea. Number three, enjoy the pain. There's this famous saying that's like, being an entrepreneur is almost like eating glass until you start to taste of your own blood. Um, be resilient and enjoy the pain. It's almost like, some people think like being an entrepreneur is almost like you have to tolerate the pain. You have to enjoy the pain. You have to know the pain makes you better. You grow through that pain. It's almost like going to the gym and lifting. You go through that pain because you know it's going to make you better. So, and by the way, this is what I usually tell my friends. If it's not hurting, you're not doing it right. Make sure it hurts, because only if it hurts, if it's sort of a mental thing that you have to go through, the pain of dealing with people that may or may not be pleasant, if you're not experiencing that, you're not necessarily pushing hard enough, fast enough. So dream big, be flexible, expect and enjoy the pain. And I think if I can give them one more advice, be realistic. What do I mean by that? To your point, don't ask for unrealistic valuations. Don't try to sort of, don't assume that you're the best in the world. No one is. No one is. Just be realistic about your strengths and your shortcomings. It's like, I'm good at certain things and I'm not good at certain things. And let's just accept the fact that, for example, I personally am not good at financial modeling. And when people tell me that this is wrong, I completely accept it and I'll just go with them. So be realistic around the whole, how big I am, how good I am, because again, many entrepreneurs, especially from academic background, think that they are the smartest person in the world, and there's no such a thing.
So in your journey then, do you, there's this kind of idea of work-life balance, right? Is it possible to be an entrepreneur and have work-life balance?
I'm sorry, I hate that phrase. I hate that phrase. My work-life balance is work more and more work. That's the balance.
That's
I kid you not. Let me just show you something. I don't know if it's okay or not. You can cut it out, but I don't know if it's visible or not. Oop. No, probably not. 3:30 in the morning. I wake up every day, 3:30 in the morning. I go to the gym. I come back on roughly around 6 o'clock. I clear my email, and I work until 8 at night. That's 6 days a week. Saturday is my only day off. And when I call day off, means that I work less. There is no work-life balance. There's absolutely no work-life balance. We only live once. We might as well make it count. And to do that, you gotta push yourself to the point of failure. I see these entrepreneurs that having a relaxed day and off and disconnected. I was like, I'm sorry, there are few choice words that come to mind. I'm not gonna say that on on the podcast here, but it's like, really, if you have time to relax, it means that you're ignoring one or two opportunities that your competition is already on it. So there is no such a thing as work-life balance. It's not for entrepreneurs. It's for people that have a normal 9 to 5 job. If you're trying to change the world, you gotta do something that is extraordinary and painful, which means that you just have to work and work and work even more.
Is there, or I should say, yeah, Ehsan, I should say, do you have maybe a final recommendation you want to leave the audience, or a question you want to leave the audience? And that's my last question, by the way.
So I guess perhaps I always have questions from people that have done it more than me and are more experienced, and I would love to get in touch. By the way, you can find me on LinkedIn. I have no social media accounts because I think they are a waste of time. LinkedIn is the only place that I am, and people can find me. And I would love to get connected to people, answer questions, but also get to learn a lot from people. I guess if I want to ask people one question is, every single person has an idea of like, I think this will work. I think this will make things better. My question is, what are you waiting for?
That's right. Ideas just, you got to execute.
Correct. If not,
Unless you do something, it's not going to go anywhere. Yeah.
Absolutely.
So, Ehsan, thank you for coming in. I mean, you have this remarkable career of accomplishment academically, inspired by your dad, your early interest in biomedical engineering or bioscience and engineering, right? And you were able to transform that from Australia to New Zealand to San Diego to Toku to having all of these clinics using your miracle AI retina imaging capability. And after the success of Toku, then you're thinking, why don't I instantiate this in something that I could wear, which does everything, right? So,
Correct.
Thank you for sharing your journey and all of the great lessons today.
Thanks for having me. It's been a pleasure.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.